All right. So again, Happy New Year, Merry Christmas, all that really good stuff. Um, did everybody get a little bit of a break over the holidays? Get some sleep? Rakaya said no. Rakaya, when you graduate, you can take a really long nap, okay? I give you permission to take a really long nap. So that's it, right? Everybody's in their last term. Woohoo! Excited? Are we excited? Are we ready? Are we ready? We're going to do this, right? We got this. We are going to do this. Absolutely. All right. So I know most of you know me. There's a couple names that I don't know. Well, actually, yeah, there's a couple names that are a little bit newer to me. So my name is Jennifer Martinez. I am going to be your facilitator or concepts of leadership and collaboration for the next 12 weeks. Um, so lots of good stuff to do. I'm originally from Brooklyn, New York. Went to high school in New Jersey, lived in Virginia for 30 years after joining the military, and then recently moved to San Antonio, Texas. I have been with Fortis for almost 5.5 years now, in a variety of roles on campus. I left campus in December of last year is when I moved to San Antonio and transitioned to online. So been with Fortis for a while. I enjoy working for Fortis. I like Fortis, so I was really excited that I was able to join online. There's not a Fortis in San Antonio, Texas. The closest one is in Houston, which is too far to drive. So I was like, I think it's like 3.5 hours to Houston. So yeah, a little bit far. I have three grandchildren. I have a 3.5 year old granddaughter. Like I said, she is getting ready to go to England for 3 years. Her stepdad is Air Force, and he is deploying for 3 years to England. I have a 1.5 year old grandson, and then I have a brand new baby granddaughter who is 2 days old now. So super excited that I got to see her. Because I am currently visiting. We'll be traveling tomorrow to go back home. So excited I got to see her. Um, with that being said, I know you've probably had this before, but we will go ahead and go through the orientation. And then we do have two chapters to do today. Um, and so, whoops, I hit the wrong button. Oh, thank you, Julianne. And so what chapter is it? I think it's chapter 4 and chapter 12. So we'll do chapters 4 and chapter 12 today after orientation. And we just sort of crash. I'm like, don't want to know what the crash was. All right, so I'm gonna share my screen. All right, so again, welcome to welcome to oops, there we go. Welcome to Concepts of Leadership and Collaboration. And like I said, congratulations. You guys are all you should be all in your last term. So that is super exciting for you guys as well. Um, you know what online learning is. Majority of you I had for community last term. So apologize if you're sick of me. However, we're going to get through the next 12 weeks together. But online learning, right? You're using computer, your internet, and we're participating in the educational program. So I get to interact with you throughout the course. We will use the online resources. I will give you guidance, right? Lead those learning activities. Remember too, when you do your NCLEX questions, I will be giving you feedback on those as well as your projects that you have throughout this term. You will have homework assignments, you'll have your learning activities, your quizzes, and your exams. And you are required to, complete all your coursework every week. And one of the things that I think is really cool about Fortis and these online courses is that you get to meet students from other campuses across Fortis. So you kind of can, learn about the different areas. Again, for any issues, computer access, course questions, grading concerns, I will be your first stop. If you have any questions, comments, and you need anything, feel free to reach out to me. In your announcements on that syllabus cover sheet, you have access to my email address, my cell phone number. Um, my email address, my cell phone number. So you can email, you can call, you can text, whatever it is that you need to do. Um, and if I cannot help you or answer your question, then I am going to direct you to the course lead, who is Dr. Mary Tenza. And Dr. Tenza can't help you. Then, of course, we have Dr. Brown, who is the National Dean of Online Nursing Education. Her contact number is here on the slide. I will post the orientation slides for you after class today, so you will have access to them. And then if there's any issues with your on-ground courses, you will contact your on-ground instructor, lab, simulation, clinical, whoever the instructor is. And then, of course, you have access to your campus deans as well. Communication etiquette, your netiquette. Just state your thoughts in a courteous, positive, respectful manner. Be mindful of how you express humor or emotional statements. Those can sometimes be misinterpreted. We want to try to keep our comments relevant to the discussion. Be considerate of others' experiences, feelings, perspective. Make sure that we're using proper language and titles, no slang, and don't type in all caps. That gives the impression that you are yelling. So just use proper grammatic or proper grammar and syntax. Online course schedule and attendance. So we have specific start and end time. So Friday afternoons from 2:30 to 5:27 Eastern time. We will meet via Zoom. You have my Zoom link. One thing that I will say, or just kind of throw out there, was it last term when Canvas went down? I think it was last term when Canvas went down. I don't remember what day of the week it was. Um, my suggestion is, because even if Canvas is down, we will still have class because Zoom does not link to Canvas. So keep my Zoom link handy, so that if Canvas goes down and you're not able to access the announcements, that you still have access to the Zoom link. Because the live sessions, as you know, are mandatory, so you must attend just like you would attend your on-ground campus schedule or classes. Um, and we have a variety of projects, quizzes, exams that you will do. The due dates are due, or the due dates for your assignments are according to your syllabus week. They are all posted in your course shell. Of course, everything will open up on Sunday, and then you have until the following Sunday to complete them. Academic integrity. Um, so your standards of student professional conduct. So all incidences of academic dishonesty and violations of academic integrity will be disciplined. All right, so that includes cheating, it includes plagiarism, not unauthorized use of notes or materials in exams, including talking to other students, forging or altering assignments, unpermitted collaborations, allowing others to copy or use work that is not their own, and giving answers from graded assignments to others. Do your homework, do your assignments, keep your information to yourself. Don't share, don't let somebody copy from you. The sites that promote cheating. So, using the sites like Sudoku, Course Hero, Stuvia, among other sites, they don't promote honor, ethics, or integrity. They are also being monitored by Fortis. So being found on these sites, whether you are downloading or submitting or posting on those sites, is going to place you on heightened monitoring for your work. So, and you can't reference them in your assignments. So that um, the first violation will result in a 0 for the assignment. A second incident, that will result in a course failure. So again, just, you don't want to be found on those sites, and put yourself academically at risk. So if they are not on your list of references in your course shell, then don't use them. Another one to stay away from too is Wikipedia. Don't use Wikipedia as a reference when you're doing your assignments. Not really a good, reliable source either. Artificial intelligence may only be used as approved by instructors on selected assignments. So, if you do use AI, you must disclose all AI use, and you must submit your original work along with the AI enhancements when you submit your assignment for grading. And then you can, of course, submit just AI generated assignments. The Code of Ethics um, from the American Nurses Association. The Code of Ethics is a succinct statement of ethical values, obligations, duties, and professional ideals of nurses, both individually and collectively. It is our non-negotiable ethical standard. It is an expression of nursing's own understanding of its commitment to society. So that's one of the reasons we look at using AI or those sites that promote cheating. Does go against the Code of Ethics from the American Nurses Association. Attendance. So I know everybody knows this policy, but attendance is only recorded during your assigned live sessions or your live session time. So Friday is again from 2:30 to 5:27. That is the only time that you can get attendance for this course. This is the only section of this course, so there isn't even another section for you to attend. Um, and so I'll take it to be marked present. You must sign in with your full name. So make sure, and everybody, I didn't see anybody that didn't. Just always make sure that when you sign in with Zoom, that your full name is displayed on the screen. Be on the camera whole time. I need to be able to see you. So there's a couple people that I cannot see, but again, I need to be able to see you. Your face must be in the screen. Anyone at work, driving, or in a healthcare setting will be removed from the session. And I can verify your sign-in times, your logout times on Zoom. So after class, I go back to Zoom. I can print a report. I print a report, and that tells me what time you logged in, if you logged back out, logged back in, and however many times it'll give me that full report. Um, Attendance is recorded in 15-minute increments. So if you're 5 minutes late, it's 15 minutes. You leave 5 minutes early, it's 15 minutes. And so just be mindful of your time. Anyone without posting attendance 14 days in a row will be dropped without notification. So if you don't attend this class for 14 days or 2 weeks, let's say you miss today, you miss next week, you'll be dropped from the class. And again, there's no makeup for missed attendance. Sorry. Um, Attendance is taken again in class by the instructor. It's turned over to the registrar before the end of the class day. So any early departures, tardies, class cuts will be recorded in 15-minute increments. A period of less than 15 minutes will still be counted as 15 minutes. So like I said, clock in, you come in 5 minutes late, leave 5 minutes early, it's still 15 minutes. Attendance records are maintained by the registrar as part of your permanent academic record. And so students with chronic absenteeism in excess of 20% of the scheduled hours for a course may receive a failing or reduced grade from the course. So be very mindful of your time. It is a full letter grade deduction. So if you miss greater than 20% of the class, you can drop a whole letter grade. So please try to make it to class. If there's an emergency, please let me know before class starts. or as soon as possible, so that I can let the dean know. You, if once you miss a 5%, you will receive an email from through Campus View notifying that you're at 5%. At 10%, you will be required to meet with the instructor. And then at 15%, you'll be required to meet with your campus administration. Just know that sometimes you don't get a letter at each one of these levels, but just keep track of your time. This one is something we didn't do in the orientation last term, but it's the uniform and personal appearance policy. Students must be appropriately dressed and groomed, portraying a clean professional appearance. No pajamas, see-through, or revealing clothing. If this policy is not maintained, then we will revert to the campus classroom policy for uniforms. And I know that you don't want to have to wear um, your uniform for your online class, but um, just, and we didn't have any issues. So, um, just putting that out there. Sorry, sending a message real quick. All right. Alcohol, tobacco, and drug abuse policy. So the inappropriate use of legal substances such as vaping, tobacco, marijuana, and edibles in tolerant states, alcohol, and certain prescribed medications as determined by the Dean of Nursing is prohibited and will not be tolerated under any circumstances. Students are forbidden from vaping, smoking, using tobacco products, including oral tobacco, and using marijuana while in uniform, including after school activities and while in public. Um, the okay. Um, And then again, it just portrays a negative image on, of a healthcare program. Students are also forbidden from using these products while in their street clothes on campus or at a clinical site. And so the virtual classroom is a classroom and it is to be respected as such. I've never had an issue, but just saying no talk, no vaping, smoking, anything like that while you were in class. Things to help you to be successful. All right. So log into Canvas at least 4 to 5 times a week to stay connected and stay engaged. Keep in contact with me. Review your course announcements throughout the week. Submit all assignments on the weeks that they are due. And then towards the end of the week, start looking to see what is due for the following week. Procrastination gets us every time. So try to, stay on top of your assignments, keep an eye on your syllabus, so that you don't potentially miss anything. So I'm sure everybody is logged into Canvas. You had to have at least logged into Canvas because you had to get my Zoom link for the course. Um, and my information is there. Um, it is under your instructor information. It is also in the announcements on the syllabus cover sheet. Again, you have my name, you have my address, my email address, you have my cell phone number. Um, so you can email me directly or you can email me through Canvas, whichever works easier for you. My office hours will be Tuesdays and Wednesdays at 9 Eastern time, so 9 to 10. I will be online during those times if you need to pop in. If those times do not work for you, email me, call me, text me. If those times don't work for you, please provide some additional days and times that you are available so that we don't have to, we don't have to keep going back and forth. If you say, hey, these are the times I'm available, then I will pick one and reply back to you. I don't know how everybody likes to do it, whether you like to print your syllabus or if you like to just kind of, download it onto your computer to have it. Review your syllabus. look at the course outline that will again show you, tell you what everything that is due each week. Has everybody looked to check to make sure that they have access to the textbook? Yes. All right, cool. So make sure you have your textbook, and then if you're missing anything, let me know. Other things, come to class prepared to discuss the concepts. Again, attend additional review sessions. So I am going to do your exam reviews will be on Sunday evening. Dr. Tenza will also, what she did last term, she'll probably do it again this term, is she was doing her Kahoots on Saturday mornings. Everything is recorded. It will be posted in the announcements. Of course, if you are able to attend the live review, that is going to be your best option. If you're unable to attend the live review, again, the recording will be posted. Any additional tutoring, if you're unable again to make it to office hours, call me, text me, email me, so we can set up additional time to meet. So if you need to, if you want to schedule your tutoring sessions, um, get in touch with me, please. Students that participate in tutoring, the live review sessions generally have higher testing scores. Some have gone up as many as 20 points. So they are beneficial to you. I know the recorded sessions are great. The only problem with recorded sessions is you don't have the ability to ask questions. And if you have a question, you have to email it, wait for a response. I try to answer within 24 to 48 hours, but I don't like having students wait. So that's why I always recommend those live reviews over watching the recordings. Not that the recordings aren't good, still watch the recordings. This is your grading breakdown. So we have 3 unit exams. That is 55% of your grade. Your specialty exam is 20% of your grade. You have 1 attempt on your leadership HESI. There will be 5 quizzes, which are 5%. So that is the KGA, which is 80%. The remaining 20% is your homework grade. So this is your professional development paper, which is at 7%, sorry. Your NCSBN position paper is 8%. Your NCLEX review questions, there's 100 questions altogether broken up throughout the term. Um, those are 5%. Then you have your discussion questions and of course your Zoom. So KGA again is your unit exams, your quizzes, and your HESI. Everything else is going to be your homework grade. Weeks 1 through 5, homework scores will be turned off. In week 6, I will turn the homework scores back on so you can see the impact on your homework on your KGA. And then in week 8, I will turn the homework scores back off. And then you'll see your KGA without your homework. And then once everybody has taken their HESI and completed their remediation, that is when I will turn the homework scores on. So HESI remediation is due Monday at 11:59 of week 12. So by Tuesday, in week 12, that's when your homework grades will be turned back on. So your combined score on your unit exams, your specialty exams, and quizzes must be 78% or higher before any credit is given for completed homework. And then after the homework is added in, you have to still maintain that 78%, right? So we know homework can play a big part in that final grade. So make sure that you get your homework turned in, get it turned in on time. Um, for your exams, as you know, you need to have two devices. So you need to have a laptop for your exam, and then you need to have a phone. Can you hear the dogs barking? No? Okay. Sorry. So you need a laptop to run your exam, and then you need a phone or another device to be on Zoom. Make sure both are fully charged or on a charger, that everything is running. You'll get your practice exam to complete, to make sure that exam soft and everything is, good to go. Um, if you go off camera while you're in the exam, you will receive a zero for the exam. So again, please make sure everything is up and running appropriately. You cannot have scrap paper. Remember, you can have a whiteboard or you can have a page protector with dry erase markers, and that must be erased at the end of the exam. Um, Exams cannot be repeated to improve a grade. So if you have any issues that may impact your performance, talk to me before the exam, not after. So I don't know. You were up all night with a sick child, you had an emergency, you were sick, whatever the case may be. Don't just come in, take the quiz or take the exam, and then say, "Hey, I'm sorry, Miss Martinez. I know I did poorly on the exam. I was up all night sick." Okay, let's try to avoid all that. Contact me before, say, "Hey, Miss Martinez, I was up all night. My child was sick. I was sick. There was another family emergency. I don't want you to take an exam that you're not prepared for and that you've not gotten enough rest for, just for you to not do your best on that exam." The exam must be taken within 7 days. All right. So if, like I said, you're sick, had an emergency, something happened, we can arrange for something else. Okay. Don't take an exam if you're not prepared to take that exam.
Do you get points taken off if you like have to reschedule it, or do you get?
It depends on and it depends on the situation. Okay. Everything is a case by case, but if you are sick and you absolutely can't do anything, then I can negotiate that you don't have, potentially don't have points taken off. Because we understand that things happen, but that's where the communication is always going to come into play. If you have accommodations, okay, anyone with accommodation needs to notify me at the beginning of the term. Um, and so just because if you had accommodations last term doesn't mean that we know this term. Notifications not provided within 10 days before an exam, that may not be able to be, the accommodations may not be able to be granted in time. Okay, there's a process we have to follow. So please make sure that if you have accommodations that you notify me as soon as possible. Exams are all held during the scheduled class time. The only exception is going to be with written approval by the faculty and copied to the National Online Dean. So, if you don't take it that day, you'll still get an absence. But like I said, communicate, please. Exams can only be proctored with a faculty member on campus with 72-hour notice and must be done during the scheduled class time. So if you prefer to take your exams on campus with a campus instructor proctoring you, I need to know 72 hours in advance, along with information or the contact information for the on-ground instructor. And it still must be taken through or during the class time. So if you, like I said, if you don't want to take it, proctor via Zoom, and you want to take it, on campus with an instructor, 72 hours notice, then I need to have the information from the faculty member that will be proctoring you. Exams are proctored on Zoom. You must be on camera the entire time. Um, Profile view, full face, fully visible. You're going to have to show your ID. If you don't show your ID or you're not fully visible, that can result in exam and or course failure. You must show your complete testing environment. So again, that 360 view, desktop walls, all sides of the computer, the chair, the floor, underneath the desk, all of that. If your ears are covered, you must show your ears just to make sure that there is nothing in your ears during the exam. If you have a religious exemption, please ask to discuss that with me so that we can ensure appropriate accommodations. And don't assume that the instructors know all of the individual, accommodations and requests, okay? Um, all right. So with missed exams, those are going to be held to the late work policy. If you miss it and you don't tell me ahead of time, that will be a zero. All right. So again, communication is going to be absolutely important, key. Exam missed for personal reasons will result in a, okay, um, will result in the late penalty if we have notification. Emergencies, those do require documentation submitted to um, Dr. Brown. Documentation needs to be submitted within 24 hours, and documentation needs to be submitted before the exam can be rescheduled. And again, the exam must be scheduled within 7 days of the class time. So our class is on Fridays, so you have to take the exam prior to the following or prior to the next class. Technical issues. If you are having technical issues, don't continue or try to continue the exam. Notify me immediately. Um, and so, I can't, there's a lot of things that I can try to help with during, if there's any technical issues, whether it's reaching out to ExamSoft. I can't allow a retake due to technical problems or other issues if you've already completed a majority of the questions. And this is why I say technical issues is one thing, but if there is something that is going to prevent you from being successful outside of that, please get with me prior to the exam, not after the exam. Your specialty exam, these are given on campus. They're proctored by campus instructors. You do only have one attempt at the HESI. Each campus schedules it according to their schedules. So it can occur anytime in week 11 or during HESI week. This exam counts for 20% of your testing grade, and the benchmark is 900. Remediation is mandatory in order to receive your HESI score. So you have to complete 100% of the remediation time. So even if you get a 900 or better, you get 1,000, you get a 1159, whatever, above 900, you are still required to do a minimum of 1 hour. All right. The rest of the scores, and I will post these when it comes down or time for HESI. These, times will be posted so that you will get reminders. Don't forget to do your HESI remediation. Remediation packets are to be submitted by 11:59 Monday of week 12. Okay, I can go into HESI. I can look at your remediation to make sure that it is complete. And then failure to complete 100% of remediation will result in a zero for your HESI. So please don't forget. Um, I will post reminders. If it's getting kind of close, I will send emails just to give you a reminder. Hey, not trying to bother you, not trying to, um, but just want to make sure that you get it done. We had some really great HESI scores last term, and a couple people cut it really close to the wire. Made me a little bit nervous, and that's one of the reasons why I will send out those wonderful little reminders. Don't forget to do your remediation. Your homework policy. Try to get your homework in on time. Um, if you need to submit an assignment late, you need to have approval from me to submit that homework assignment late. So you need to contact me before it is late to let me know that it is going to be late. The late policy is 1 to 7 days late. you'll get a 10% reduction in that assignment. After 7 days or 8 days or more, that will result in a zero for the assignment. So make sure you get your homework in on time. Always look at your instructions, and we're going to go through some of the instructions for some of the assignments for this term. Look at your grading rubric. I will show you those as well. Um, and then other things, APA. Use your current edition of your APA manual. You have access to the Learn resources in Canvas for Purdue OWL. That will help you to set up your papers in APA format. Only use nursing journals or textbooks, making sure you have enough or sufficient references or resources for review. Try to use resources that are no more than 5 years old. Anything over 5 years old may be out of practice. So you want to keep up to date, and 5 years is about the average. Make sure your research relates to your topic, and then summarize those key points in your own words. Okay. If you want someone that likes to use quotes, but even if you summarize, you want to make sure that you are giving credit to whoever wrote that information originally, using in-text citations as well as adding those on your reference page. Again, communication is key. Make sure you plan. So you read your book, use your resources, attend the review sessions, ask for tutoring if needed, and then, prioritize. Again, I know most of you, this is your last term. You want to graduate. You want to move on to bigger and better things. And go out there and start taking care of patients. So communication is going to be key. I can't help you if I do not know. So again, can't stress communication enough. Any questions so far? And I know you've had the online orientation how many times over the last, few months, but just gotta make sure we reiterate that information. All right. The next thing I am going to do is, I don't know if it'll let me, but I'm going to try. It will not, but that is okay. I have this open in student view first, so I'm going to share my screen again. This is student view. All right, so this is what your Canvas shell looks like. Your student resources are all here. You have access to all of this. It gives you your information about your textbook as well as your reference package. Excuse me. So your clinical skills, your HESI, your calculate with confidence, your nursing skills, your Saunders, all of that good stuff. There's exam soft information, there's Zoom guidelines, and there's a list of resources for who to contact. Um, your ebook setup if you need help with that. Your ebook. There is your writing center. Okay. So, excuse me, there's lots of different tips under here, how to avoid plagiarism, APA, the frequently asked questions, your HESI registration, which all of you should have registered, but just in case you need a little reminder. And then, all right, so I'm going to skip that one. There is your ebook registration. Oh my gosh. Your syllabus quiz, your technology quiz, and then there is my contact information along with Dr. Brown's contact information. I will go in and I will also add Dr. Tenz's information in here should you need it as well. But you have the Zoom link, you have my email address, you have my cell phone number. Again, you can call, you can text, you can email. And then I think I'm going to leave student view now. I'm going to go back to modules and I'm going to open up the professional development plan instructions. All right, so your professional development plan is due in week 6. All right, but your instructions are here. So you're going to write a 3 to 4 page paper. It's professional development plan for NAPNE, standard of practice and educational competencies. So here's how to title your paper. And here are the details. So if you click here, it'll preview it for you, or you can download it in. But the professional development plan is a self-assessment of your readiness to transition into nursing practice. How ready are you as a soon-to-be nursing graduate, ready to transition into practice? Right? So you have the National Association of Practical Nurse Education and Service Standards of Practice and Educational Competency of Graduates of Vocational, Practical Vocational Nursing Programs. All right. So, you are going to describe the competencies outlined by NAPNES within the 6 standards of professional practice. So these are the 6 standards: professional behaviors, communication, assessment, planning, interventions, and managing. You will also click on the current nursing link. This is Patricia Benner's From Novice to Expert. All right. And so she outlines novice, advanced, beginner, competent, proficient, and expert. So you're going to use the NAPNE 6 standards and you are going to use Patricia Benner's theory to identify what your current competency level is within these standards. So you're going to read about professional behaviors and then you are going to determine, are you a novice? Are you an advanced beginner? Are you competent? Are you proficient? Are you an expert? And there is basically a definition underneath each one of these to kind of help guide you as to where you might fall in. For each standard, choose one competency and complete a self-assessment. All right. So again, are you a novice, advanced beginner, competent, proficient, or expert? And then identify your strengths and weaknesses, and describe actions that would support improvement and advancement of your skills in professional behavior and communication. And give an example. So, for example, let's use communication. All right. So, I don't know if I look at communication here, um, where is communication? That might be assessment, communication. So we know communication is how the process by which information is exchanged between individuals, verbally, non-verbally, and in writing or through information technology. All right, so upon completion of a nursing program, so you should be able to effectively communicate with patients, significant support persons, members of the interdisciplinary healthcare team, incorporating interpersonal and therapeutic. So let's just say, all right, I picked, so communication is the one I picked. I am really good at interacting with clients, significant others, and members. I would probably, if I looked back here, I would pretty much say, I never say I'm an expert or anything, so I'll say I'm proficient, okay? And then so I'll describe that and then, what are my strengths and weaknesses? Okay, so I'm a clear communicator and able to get my point across. I make sure that my verbal and my nonverbal match. Weaknesses, I don't like discussing end of care issues. I am going to be honest with that. Now, I'm not sure how many people like to discuss end of life care, but that's always going to be one of my weaknesses when it comes to communication. All right. So what can I do to help improve that? I'm going to list that out. All right. And then when was the time that you have displayed that? All right. So you can write like one time at clinical, I had to reinforce, education from the nursing instructor about, I don't know, a healthy diet, whatever it is, and you were able to communicate that well. Okay. So provide that example. Um, and then you have your assignment details. Um, oops, that is not, there we go. This is your grading rubric. So this is how your assignment is going to be graded. So, it is out of 60 points. All right. And so make sure that you are looking at your grading rubric and the assignment instructions and making sure that you are covering all of the required information within that assignment. I will go over it again if need be, but just wanted to give you guys a heads up. We go back to the syllabus to have it up somewhere. We'll just do it this way. All right, your course syllabus. So I talked about your professional development plan that is due in week 6. You also will have your NCSBN position paper. Your NCSBN position paper is due in week 8. All right. So I know you might not be able to, I don't remember if I turned it on. If not, I will turn it on so you can at least see the directions. Where is it? There it is. It is not a presentation, okay? It is a paper. So your NCSBN is also a 3 to 5 page paper. You will have a title as well as a reference page added. So it's 3 to 5 pages written plus a title page and a reference page. So if you write 3 pages, it's actually 5 when you add the reference page and the title page. This is from the perspective of an instructor. Write a paper for practical nursing students that explains the act of delegation within the scope of the PN role using the NCSBN's paper as the main source. Okay, so you're going to be the instructor and you are going to discuss the act of delegation. You'll read pages 1 through 18 of the NCSBN's Working with Others. It's a position paper. If you click on the link, that'll bring it right to the paper itself, and you will go through the first 18 pages. There is a nice little chart on communication, um, and a lot of it's a really good read. I've read it a couple of times. So you will read the first 18 pages. It does go on. It's much longer than 18 pages, but you need to at least read the first 18 pages. Okay, so again, it is from the perspective of an instructor. Okay, so you are going to discuss the active delegation within your scope of practice. So you want to include key points relevant to your PN scope of practice. The NCSBN is going to be your major reference, okay, but you will need one additional, and it is a Word document. So yes, you do have access to this because it was open. All right, so, and then you have access to your rubric to kind of make sure that you are understand, what the requirements are for the assignments. All right. I don't know what happened with my little mousey. All right. So that is a brief overview. You will have your first quiz next week. So quiz 1 it's 10 questions. It will be next Friday, right at the beginning of class. So do not be late. If the quiz has already started and I have already given out the password, then I will not let anybody else in until after the quiz is complete. So please be on time for class. So you'll have your first quiz next week. You'll have your second quiz in week 3. Your first exam will be in week 4. Um, Week 4, generally speaking, we will meet on Friday evenings with the team to review any or to review the exam. Um, and you should, not saying something happens, we don't meet on that Friday, something changes, just be aware. But generally speaking, you should have your grades by Friday night or Saturday morning, as long as that team meeting does happen. Um, Quiz 3 is in week 5. Exam 2 is in week 6. Quiz 4 is week 7. Um, Week 8, there is no quiz and no test. Week 9 is quiz 5, and then week 10 is exam 3. Your HESI exam
This
is
is
in week
all updated.
11.
I'm sorry. This is all updated in the syllabus, right? Like currently, just so I could write it in my planner.
Yep,
Okay.
everything's in your syllabus. Yes, ma'am. All right. So everybody has my contact information, knows to get how to get a hold of me. You have your syllabus, you've done your technology quiz, and what else? And I'm just gonna peek real quick. Today is Friday, so let's see. So we have majority did their discussions. Good job. Everybody's done. There's one that still needs to do the technology quiz, but the syllabus quiz is all done. So good job. Everybody is good so far. All right. So with that being said, anybody have any questions for me so far? Now we'll continue to review the assignments every week. I'll just kind of touch base on the assignments just to do a check-in. How is everybody doing? um, just to make sure that you understand and you're good to go with the assignments. So I don't want anybody to feel like they can't ask questions or anything like that. So we will touch base on the assignments every week just for a minute or two. If there's any questions that arise regarding the assignments, please feel free to reach out. All right. So before we get started, we are at an hour. Let's go ahead and take a break. Be back at 3:40. We're on a break, Mikkel, until 3:40. All right, giving everybody a second to get back on. All right, so again today, we are going to cover chapter 4 and chapter 10. So
Chapter 12.
I'm sorry. I did say 10. No, chapter 12, you're correct. I apologize. Jumped ahead. So we'll do chapter 4 first, just since that technically makes sense, right? To do chapter 4 first. So chapter 4 is how practical and vocational nursing evolved. So how it started, where it is, um, and so kind of give you a little bit of background information about your career choice. Um, let's see, who are we missing? We are missing, who are we missing? We're missing Ashley and Latrice. All right, so Akoya, are you there? Okay, I can't see you. All I see is your ceiling fan. Um, all right. Everybody else is good. All right. So again, chapter 4 is the evolution of nursing. So there's lots of changes that has happened throughout the history of practical nursing. Um, and so um, some of the major changes that have occurred, we've had an increase in the required formal knowledge base, as well as now a requirement for licensing, in order to practice practical nursing. So prior to licensure and formal education, a lot of the practical nurses were untrained or poorly trained. And they also had unlimited and unsupervised freedom to practice, which could be, an issue. So we look at some of the, you know, um, things that have changed also too. So we have training in educational programs. So you get theory, you get simulation, you get your labs, you also get clinical hours. And then after licensing, you are permitted to perform the job role as a licensed practical or licensed vocational nurse, as long as you are within your state regulations. And then most state regulations stipulate that LPNs work under the supervision of an RN or a healthcare provider. So depending on where you work and what your practice is going to determine who your supervising person is. So work in a hospital, you're going to work directly under an RN, but if you work in a clinic, even maybe a doctor's office, um, your supervisor may be a doctor, it may be a nurse practitioner. So it really kind of depends on where you work. So we'll talk about the first school of nursing. So the first real school of nursing was in Kaiserwerth, Germany. It opened in 1836. And Florence Nightingale was actually one of the students. And we know Florence Nightingale is known as the founder of modern nursing. Um, And during the Crimean War, she nursed the wounded with untrained nurses. So she had a little bit of education herself, but she worked during the Crimean War with untrained nurses. And then in 1860, Nightingale herself established a school of nursing in England, during which she also wrote mm, many books. Um, the most famous book is her Notes on Nursing. It's a good read. I've read it. Um, her core beliefs are, kind of um, what, Nightingale's formal beliefs were, was perfection of mankind. It was that nursing was a sacred calling. You have to really want to do what you are doing when you become a nurse. It's a commitment to work for mankind. It's not a business. And so nursing was a way for her to work towards that perfection of mankind, and her own salvation. She was against licensure. Okay. To her, it was too much like nurses being in a union. So she was against like in licensure, likened to a union. And she pushed for nursing to be a respectable profession, or vocation. She was smart, she was well educated. And so that made her a big critic, of nursing and the nursing role. And so she wanted nursing to be respectable, and she continued to push for that. When we look here in the United States, the first nursing school that opened here, in America was actually started by Pastor Fleidner. He was German himself, but he did open the first school of nursing here in the United States. The hospital that is known as Pittsburgh Infirmary, still exists in Pennsylvania, but um, it's now, what is it? It is Passavant Hospital now. So it doesn't have the same name. It changed from Pittsburgh Infirmary to Passavant. And as the nursing shortage continued, hospital-based schools of nursing emerged as a cost-effective labor force for the hospitals. So even back then, we had a of course, nice little, nursing shortage to deal with. And so a lot of nursing students worked within the hospitals, as a result, during their education. And so it was cost effective, right? Because we don't pay students, to go to, to work during your clinicals, or you don't get paid for that. And so a lot of it was long hours. It was a lot of work. They didn't, obviously weren't making any money. And so it was, a potential issue. Um, and so the living conditions were bad. And it was still very stressful regardless. Nursing school has always been stressful then as well as now. And then in 1893, I mean, this is a long time ago, but in 1893, we had the Ballard School, that opened in my hometown of Brooklyn, New York. Um, the courses were 3 months long. Could you imagine taking a 3 month nursing course and be expected to know everything that you're supposed to know? But yes, so they were 3 months long, but they focused mostly on home health care for chronically ill, elderly, and children. So they went into the homes, they taught the basics of cleanliness, as well as control of communicable diseases to families in the New York slum areas. And that was primarily where, um, the practical nurses worked. They did a lot of the home health community type nursing. Um, and then, the other things they would do would be cupping. They would also do midwifing roles or midwife roles. What else did they did leeches or applied leeches. Anybody heard of leeching before? No, yes. So leeches, they suck your blood, right? So we can apply them to areas that have decreased blood flow, help to increase blood flow to the area. They actually have medical leech farm, leech farms. I think that's what they're called, that they raise leeches specifically for medical reason or medical purposes, just generally in a cleaner environment. Um, they also would do, the nurses would also do enemas. And then as we get into the 20th century, by 1903, states began to take steps that ultimately led to monitoring of practical nurses. So during this time, nursing organizations were developed. So we had the National League for Nursing, or no, the National League of Nursing Education was the original name. It's now the NLN, which is the National League of Nursing. Um, and it developed a nationwide system of standardization of nursing requirements for practical nursing. So let's say back before then, if you were in Florida or you were in Ohio or in Pennsylvania or Virginia, wherever your campus is, you may have completely separate curriculums. There was not a whole lot of standardization as to what they were teaching you. And so that was one of the goals of the NLN was to standardize the requirements for practical nurses. Mississippi was the first state to pass a law requiring licensing of practical nurses, and that was back in 1914. And so this was important. Why? Because before then, no one had any way of knowing who was providing nursing care. So even, we do have some of those issues going on today, right? But before, people could just say, "Oh, I'm a nurse," and provide nursing care. And they, didn't have to have, they didn't have the license to prove that they were, able to provide that care. And then in 1938, New York was the only state to have mandatory licensure. Um, and now all states, right, require mandatory licensure for nurses. So practical nurses, registered nurses, um, nurse practitioners, right? It is mandatory in order for you to practice, you have to have that nursing license. So get through school, right? And then you have to take that NCLEX so that you can practice. In 1944, the U.S. Department of Vocational Education did a study of practical nurses. And so this is the first time that the tasks of a practical nurse were agreed on. They, the specific duties were outlined. Um, Sorry, hold on one. Okay. The specific duties were outlined and big emphasis was maintaining aseptic technique. They also just used phrases to describe the scope of the practical nurse's job, and they may sound very similar to the nursing process. But the practical nurse's scope of practice, the terms were judge, appraise, recognize, and determine. All right, rather than the assessment, diagnose, plan, intervention, um, and evaluation. Initially, judge, appraise, recognize, and determine describe the scope of practice um, of the practical nurse. Then we had the Joint Commission or the Joint Committee, sorry, on Practical Nurses and auxiliary nurses. Or I can't even say the auxiliary. I can't say the word for some reason today. Let's try that again. The Joint Committee on Practical Nurses and Auxiliary Workers in Nursing Services recommended the use of the title licensed practical nurse, and this was in 1949. So really not even that long ago. It also differentiated the tasks of the LPN and the RN. They saw the LPN as being under the supervision of the RN. They also suggested that practical nurses organize to make decisions on their employment standards and their working conditions, and a variety of other things. And so, because of the work of that joint committee, a lot of the practical nursing programs were strengthened with regard to the contact or the content that they provided. And they also focused here on the preparation of the instructors within those practical nursing programs. And then as we move even further along, um, by 1952, about 60% of the nursing workforce was practical nursing. Okay, so that's the majority of nurses right there were practical nurses. Um, and so, we do have to worry, they worried about, um, the different levels of care provided between the RNs and the LPNs. Um, and so, there were some more changes that were made across the way. And then in 1965, again, not really all that long ago, the American Nurses Association presented a position paper, and they outlined the ways or outlined how we can solve the issues of the different levels of the nursing profession. So LPNs versus RNs. So they recommended that all RNs went to a 4-year college program, and then all LPNs from a 2-year technical program. All right, so they wanted all RNs to do the 4-year program, to the RNs to do the 2-year technical program. And a lot of programs, especially those hospital-based programs, closed during that time. And so then in the 80s, we had, again, a little bit more of a difference, but this is also where we ended up with the 2-year associate degree programs in registered nursing, right? So if you wanted to be an RN, you didn't have to do the 4-year college program, right? You can do the 2-year associate degree program. And not all states adopted that. And so we had a serious nursing shortage that even occurred back towards the late 1980s. Um, and, that's, of course, we know those 2-year programs obviously still survives because we have a lot of 2-year programs, through your community colleges, and things like that. We also have, schools like Fortis, right, that have a little bit of a shorter education program. They go year round, right? So you can finish your program a little bit earlier and get out into practice. And then in the 1990s, too, assistive personnel were hired to give care. And so, one of the biggest concerns that we had with the assistive personnel or the unlicensed assistive personnel was their legal responsibility for the care, right? Because we know if we give an assignment or we delegate something to a CNA, unlicensed assisted personnel, so a care partner. What else do we heard them? I've heard them called patient techs, care techs, care partners, variety of different names, right? Um, it is still the responsibility of the licensed nurse, whether it's an LPN or an RN. They are ultimately responsible for the care that is provided by that unlicensed assisted personnel. But we know, and I'm sure some of you are CNAs and you know how important your job is, and the value that you add to healthcare. Um, and then during the 1990s as well, the LPNs moved out of the hospitals and back into the community. So just for context, when I first became, as first started school as an LPN, LPNs were working in the hospitals, all over the hospital, ER, med surg, OB, wherever. And then as I was getting ready to graduate from my practical nursing program, um, they were phasing LPNs out of the hospital. All right. So we moved LPNs out of the hospitals and back into the community. All right. And now what are we doing now? We're moving them back into the hospital, right? For a variety of reasons. The nursing shortage. They're also, to help provide care. Their skill set, your skill set is needed in the hospitals. A lot of hospitals are going to like a team-based approach. So it is, they will have their, the RN, the LPN, um, and then like a CNA. Um, hold on one second. All right. All right. So Ashley, Destiny, and Akoya, please turn your cameras on. All right. So then we have NCLEX. All right. So the first computerized testing, NCLEX was in 1994. All right. That is when the NCLEX became computerized, um, and people could take their NCLEX online. I will tell you a story. So my mom was also a nurse. And so my mom became a nurse well before 1994 with the computerized testing. And she, what do you call it? I grew up in Brooklyn. I went to high school in New Jersey. She went to nursing school in New Jersey. And so it was 2 days of testing. I can't remember if it was 6 hours or 8 hours, but it was literally 2 days of testing. Traditional nursing schools graduated in April. All right. And so they were eligible to take their NCLEX in June. And so she went down to Atlantic City in one of the casinos. They had, I guess, I don't know if they did like a ballroom type thing or something like that, um, and had it set up for testing. It was all handwritten. So it wasn't just multiple choice, it was fill in the blank, it was short answer. They also had to do a care plan, so they had to write out a care plan. They didn't have textbooks or any of that stuff. So it was 2 days of testing. It took 6 months for them to get their grades. Okay, so imagine you have to wait, some people get anxious waiting like a couple days, right, to get their grades. They had to wait 6 months to get their NCLEX score, and it was actually graded. All right, so they actually got a grade and not just a pass or fail. They could work as a what do you call it, like a graduate nurse, um, and um, while they were, doing it. But then if they failed, obviously they couldn't work anymore. They had to wait until the next June. It was only offered once a year back then. So can you imagine? Like you graduated nursing school, okay, yeah, I didn't pass my NCLEX the first time. You have to wait a whole year before you can take it again. Um, um, So yeah, it's just crazy how things have changed. And then in 1996, the long-term care certification became available in some states. So LPNs that wish to work in long-term care, they could actually get a certification. And if anybody is interested in that, you can go and you can actually Google it. I cannot remember who offers it. I want to say it's through NAPNIS, but I could be incorrect with that. Um, and there are other certifications that are available for LPNs as well. Um, the goals, and then, and who here works in long-term care now? Anybody, do you guys want to stay in long-term care or do you have a desire to go somewhere else? Yes. So I love long-term care. Long-term care to me is, it's one of my passions. I love long-term care. Not many people want to make it a goal and they don't want to stay in long-term care. And so it's, as we look at this nursing shortage and we look at the population growth and we look at the number of people that are age 65 and older, there's going to be a huge need for long-term care in geriatric prepared nurses as that baby boomer generation, retires and gets older. Um, what else do we have? And then COVID. Let's talk about COVID. So COVID put a huge strain on healthcare workforce. And so for a variety of reasons, a lot of nurses either um, left nursing just because of the stress after COVID, the working conditions. Um, Getting sick. We lost quite a few nurses during COVID as well. Lots of different issues. And it's still, nurses, we face a lot of issues within, what we do. And so it is something that, we're ever striving to replace the nursing workforce, to try to help staffing to get more nurses in the nursing workforce, right? Then we can help to alleviate the shortage that is out there. So, what are some things? What do you think as we just talking? What are some things that you see when you guys are out in clinicals that would, that you can see that are some stresses for nurses?
And
'Cause I
so
know you
the
guys have done
long-term
clinicals.
care is the ratio. Sometimes the nurse to patient ratio is too much.
Okay, yeah, nurse patient ratio. So I worked, like I said, I've worked in long-term care. That's my primary passion. It is a lot that we have, and there have been multiple pushes um, to try to limit the nurse-patient ratio in long-term care. And one of the biggest reasons why they won't is it's not cost effective, right? To add extra nurses, in those capacities. But you're correct, absolutely. In long-term care, right? You can have 36 people to one nurse, right? And sometimes even more. What are some other things that you see
Short staff.
short-staffed? Why do you think they're short-staffed? We just don't have enough nurses, right? If we don't have enough nurses to fill those empty holes in the workforce, right? That is potentially a huge issue. Um, and it's a vicious cycle, right? So there's lots of reasons, do people really want to go into nursing? We graduate nurses, then they have to take that NCLEX. Some people do well on NCLEX, some people don't, right? And if you don't do well on NCLEX, then you can't practice as a nurse. We also, some people go into nursing and then realize, oh my gosh, this isn't what I want to really do, right? And so they take all that time to go to school and they don't practice as a nurse. Nursing schools too can only accept so many students, right? So we can only get so many students in the door, get them educated, get them graduated. And so it will be, it's just a a cycle. I thought it was interesting. We hear about the nursing shortage. So I was doing research on the nursing shortage, and Texas is one of the only states that currently does not have a nursing shortage, or projected to have a nursing shortage. So I thought that was really interesting. I picked the one job to try, or the one state to try to find a job in that doesn't need a whole lot of nurses because there's plenty of nurses in Texas. Um, and it's interesting though, because coming from Virginia, there's lots of nursing schools in Virginia. There isn't as many in Texas. So it's just kind of interesting, but there's also more, lots of universities, lots of community colleges, community college systems, that offer nursing programs. Not a lot of schools like Fortis. I think there's maybe like one school like Fortis, or two. There's two. One's a bachelor's program, one's an RN program, and the one that has the RN program doesn't even have a practical or a vocational nursing program. So it's just really interesting the dynamics, and look at the size of Texas compared to some other states, and you would think that they would have a bigger shortage just because of the size of the state. So I just thought it was really interesting. But if you're interested in looking at the nursing shortage, you can Google it. It'll even map it out for you, like what states have, you know, um, the biggest lack of, nurses, and where the gaps in nursing is as well. So I just thought that was super interesting. Um, but you got some, still have a lot of work to do. Um, as you finish up your programs. So for who, raise your hand if this is your last term. All right, awesome. So getting ready to go out, huh? And get it all done. Raise your hand if this is so is everybody taking two courses this term or three? Just put like a two or a three, three, one, three. Okay. All right. All right. So you've got a really full schedule ahead of you. So the ones that I'm assuming you're taking mental health as well, and capstone, is that the other two courses? You guys
Yeah,
don't have mental health on Friday mornings, do you?
no.
Okay. All right. I just last term we had some that had mental health right before leadership, and it was a little rough for them, and I felt bad for them. So
Professor Martinez, who comes up with the times? Like, is there any way we could tweak the times a little bit?
I cannot. Yeah, that is, it's a combination of the online dean and the campus.
So there's no way we could do like 2 to 5 instead of 2:30 to 5:30.
Um, I have no control over the times for the class. Um, is there, I mean, you can always, I can't change it. Let's put it that way. There's no way that I could change it. Unfortunately, or I'm sorry, it's not unfortunate because I'm here too, but, so yeah, no. Once the schedule is set, there isn't any way for us to change it. All right. So does anybody have any questions on chapter 4? All right. So then the next one is going to be chapter 12. And chapter 12 is all about the wonderful nursing process. And so we should all understand the nursing process at this point. Um, let's see. Let me do this one more time. All right. So, what's the nursing process?
Red pie.
Bye.
Bye.
Okay. ADPI. So what is A?
Assessment.
Yes. What is D?
Diagnosis.
Diagnosis.
Okay. What is P?
Planning.
What is I?
Implementation.
Implication.
Implementation.
And then E?
Evaluation.
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 Give me- All right. So we look at the nursing process. All right. So the nursing process was established by the American Nurses Association a long time ago. Um, and so it is something that is evidence-based. It is a problem-solving format that we can use as nurses. It's an organized way to identify and respond to client needs within within our scope of practice, whether it's an RN or an LPN. And it's also a great way for us to communicate from, from or with other nurses, with other caregivers, as well as other members of the healthcare team. And so, who here, and some campuses do care plans, some campuses do concept maps. So, who is anybody written a care plan before?
I think we did one time with makeup clinicals.
All right, so care plans are pretty extensive, right? They can be pretty extensive. Do most of you guys do concept maps? Do you
Yeah,
like concept maps?
I do.
Yeah. So, I was sharing with one of my other groups. Um, I know it's just a different, it was a different time. I told you about my mom graduating from nursing school. So I wish I still had them. I don't know what happened to them, and I'm really kind of bummed because I would definitely show you guys. But the legal size paper, right? Normal paper is 8.5 by 11, right? Then we have those like the long legal papers, right? That are little bit longer.
The
So
yellow
imagine
ones,
those. I'm sorry.
the yellow pads.
Yes, like the yellow pads. Um, Imagine landscaped, okay? And they would have to write out their care plans. And one of her care plans would be like 16 pages, all handwritten. And I remember thinking when I was getting ready to go into nursing school, like, oh my gosh, I don't think I could write a care plan that's 16 pages. They were super thick. And they had to do one for every clinical day. Okay. And I don't remember because it was a long time ago. I was young. I don't remember what their clinical requirements were. But they would have to write a care plan for every clinical day that they had. And so whatever patient that they had to write that care plan. And I'm like, oh my gosh, when I go into nursing school, I really hope I don't have to do that. And of course I did, and I had to handwrite it, but it wasn't 16 pages. It wasn't as in depth. Things kind of evolved a little bit over time. And then we had concept mapping. And so concept mapping, unfortunately, when I became an educator a long time ago, 12, 13, 14 years ago, I didn't know what a concept map was. So I had to learn concept mapping because I was so used to doing care plans. And so both of them are very effective. Concept map obviously is a much shorter version of a care plan, but it is something that we can still learn about disease processes, right? And provide care for our clients. So again, you're absolutely correct with your nursing process. It is the ADPI assessment, nursing diagnoses, planning, intervention, evaluation. So when we look at that nursing process, there are some things that the LPN can do. There's and that they can do independently. and there's things that they need to do in a more dependent role versus the RN. So the RN can do all five parts of the nursing process independently. So assessment, diagnose, plan, intervene, and evaluate. They are completely independent as a registered nurse. The LPN or LVN has more of a dependent role in some aspects of that nursing process. Now, LPNs are absolutely independent, right, when they're gathering data or completing their assessments and in their interventions. Okay, but the nursing diagnosis, that is an RN responsibility. No, you can help the RN. You can sit down with the RN and you can discuss the care and do all of that stuff. And so you have that, it's still a dependent role, but it's a collaborative role. The planning as well. Planning is a collaborative role with the RN, and then evaluation. So as a LPN or LVN, you will carry back your findings to the RN to see if our patients meet those roles. So again, the RN functions independently in all five steps of the nursing process. The LPN is independent in our data collection and our implementation and works collaboratively with the RN in the diagnosing, the planning, and the evaluation phases of the nursing process. Okay, so there are different roles. So I will. I'm sorry. I know you guys have the PowerPoint slides, which is why I wasn't sharing my slides or in my screen, but I can share my screen. So gathering data. What are some examples? Give me some examples about subjective data. What are examples of subjective data?
The patient says they
Anything
have
that
a
the
headache.
patient tell you.
All right, the patient telling me something. Okay. So if the patient tells me something, that's a symptom, right? So
Hmm.
symptoms are going to be subjective, right? So give me another example. Give me a specific sample example.
My stomach hurts.
Absolutely. Sorry, I didn't hear you. Whoever said something. I have a headache, right? My big toe hurts. I broke a nail, right? My chest hurts. I can't breathe, right? Those are all what? Those are all subjective findings, okay? Or symptoms, right? So that's something to think about too. What's objective data?
Lab
Seeing the
value,
fever or seeing them
T's
throw up.
Yep,
issues.
seeing them throw up. It's lab values. It's their
We
fever.
was taught that the only everything is subjective. The only thing is the only objective thing is labs.
Vital signs are
Well,
objective.
the only objective thing that
Oh
comes
wait,
from the
the only
patient that
thing
they could give
objective that
you.
can come from the patient, right, is labs. That's the only
Yeah.
thing objective the patient can tell you.
Okay, yep. So yeah, so objective is something that we can quantify, right? So these are signs, right? So these are things that we can see, feel, smell, hear. I always say taste because you ever smell something so bad that you can almost taste it? So, yep. Um, so I always throw taste in there, but it's something that we use our senses for. It's our labs, it's our x-rays, right? Um, so again, subjective, what the patient tells us. It could be a caregiver, it could be a parent, it could be a loved one, a family member. And then objective is something that we can quantify, right? We can identify that. So yes, if the patient says, I feel I'm nauseated and they throw up on you, right? You can quantify that now, right? Because you actually saw them um, the results of them saying that they were nauseated. So really understanding the difference between the subjective and the objective information is super important. Verifying data. So verifying data or validating, that's another step, especially when we look at critical thinking. And so anything that you would need, would potentially need to verify, especially if something isn't matching with between what the patient is saying, what you are seeing. So we can look at, their medical records. We can even compare it with, other nurses, other staff that are involved with that client. And so we want to make sure that we are kind of, making sure that we're validating that information. And sometimes even with that too, we can even ask family members or, caregivers, if they during the, that to help us clarify information. And then we would document that. Um, and always communicate the information. And that's one of the biggest things. The how primary way that we communicate is through documentation, right? How many of you guys, when you go out to clinicals, write nurses' notes?
Well, we didn't learn that yet.
You haven't learned nurses'
I
notes?
learned nursing notes in gerontology class, clinical.
Okay.
Yeah, our clinicals are poop.
We don't do any, we don't do a
Yeah, they
lot.
do a lot of CNA, hands-on care, but we haven't got a chance to. And a lot of our clinical sites that we have been at, the nurses strongly make sure that they
We
don't
don't
want
do
to
anything.
pass the meds that much or around the clock that much. But a lot of like hands-on care.
We've done a lot of, we are advanced at CNA work. We don't do a lot of, we don't do a lot of LPN work.
Yeah. Which I know, like, you have to do bedside care, but it's just like we barely pass meds.
We just
Okay.
started passing meds in
So,
5.
so how do I ask this question? So your instructors don't have you write nursing notes to show her?
I
No.
only had one instructor because I had to repeat med surg 1. So when I had her the first time, Miss Edie, she had our clinical group do like nurse notes and stuff like
Miss
that.
Edie ate down.
Yes, we
Yeah, Miss Edie, but she left.
Yeah,
And
not
she's very
everybody
old.
had
She's
her.
very old school. She was like one of those old school teachers that still stuck by like the book and stuff like that. So I did say I had a little experience with her. But when she left, our new clinical teachers now.
No.
Yeah, not everybody had her. Like for my experience in clinical for the first, we were into clinical term two. And for the whole 3 months, I'm advanced at taking blood sugars and doing like bed changes, but we didn't pass meds. We didn't,
We wiped a lot of butt.
mhm.
That's
We
crazy.
didn't
I still don't know how
look
she
at
was
like
doing
charts. We didn't look at the computer.
Yeah, she was like the only one that like made sure at the nurses station let these nursing students get these charts and stuff like that out. But when she
Yeah, not
left, it
everybody
was
had that experience though.
like, yeah.
Okay. Um, so my concern is that when you go out into practice, how are you going to know what to document and how to document?
They claim that since we're in 5 term, they're adding that in a new curriculum for
And then
5
they
term
say that
now.
we'll learn that stuff in practice and it's more important to know like the processes about like hypothyroidism or like diabetes or stuff like that. But yeah.
Okay, well, what if you have to document that the patient is having symptoms of hypothyroidism? What are you going to write?
Symptoms of hyperthyroidism.
Um, so documentation is, and I know everybody, I'm sure, has heard the saying, if it's not documented, it's not done, right? And so, um, there's a lot of, and unfortunately, I don't have unlimited time to discuss documentation, but documentation is an essential part. And you also look at the different EMRs that you'll use out in practice, which is the electronic medical records. Okay. Some of the electronic medical records are going to be, um, like you're going to click through an assessment, right? You're going to kind of highlight some of the areas that, that or highlight the symptoms or the things that the patient's experiencing and, kind of skip through the ones that they are not. But you would still have to document anything that's not covered in those little clinical check boxes. If you're, working with, there's still going to be a narrative that would need to be completed. In some cases, you may like, what if the computer system goes down and you have to write out a whole head to toe assessment, right? So this is all the importance of documentation. Um, a lot of times with medication and administration, understanding the basics of how, of what to do, right? Making sure you do your 3 checks, your 2 patient identifiers, that you're verifying the medications prior to giving them. That could be OJT. Um, but that documentation piece is something that really needs to be practiced. You're not going to perfect it in nursing school, but it just kind of helps you to what's the word I'm looking for? Narrow in on what's important and what's not, and what you should write and what you shouldn't write when you are documenting on a patient. Um, is kind of,
I've heard like about that. Like my one friend told me somebody she knows had to go to court about documentation from a doctor, but like you
Mhm.
basically had to cover your behind and make sure all bases are covered. We've never, at least what I know, is that
Yeah,
there's not a lot of experience with that because some of the sites that I've gone to for 6 months for the 2 terms, we didn't do any of that. We did blood sugars and patient care. So
yeah.
And on the other hand, here in Cincinnati, that's all we did was head to toe and nursing notes, the whole clinical.
Right. So it's different according
And
to
then
what
it's
campus you're
another,
at.
instead of the CJ Sims, we do some other type of assignment, and it's kind of similar to the documentation that we have to do.
It's like some chart.
Yeah, the Sim chart.
Yeah, I
That's
like some
kind of,
chart. It's way better now. I
it
like that
helps
one.
with documentation and how to document and how you're supposed to word things. Like that helps you. But we did a lot of nursing notes in Cincinnati campus.
Yeah. But it does help you because you need to document all that data that you're collecting when you're going in and you're doing that assessment, because you're not there 24 hours a day, right? You're not, you're not gonna be the one that is providing care 24 hours a day, 7 days a week, right? And so we need to be able to document that assessment, document the information, um, so that the next shift and the next nurses coming behind you, if you, let's say you forget to do, to document something or you forget to report something off to the oncoming nurse, right? Then they can go into your nurse's notes and they can see that information. Just like the trending of data and monitoring wounds, and I'm trying to think of what else. Even, I don't know, for whatever the disease process, are they getting better? Are they getting worse? Right? We have to have a way to trend that data, and it's going to be through your documentation that you are getting that information. Um, and then, so things that make it difficult, um, some of the barriers to data collection, not enough time. That's always going to be a big one. Um, and for some of you that were saying you did a lot of head to toe assessments, right? That first head to toe assessment might have taken you 2, 3 hours, right? Now you may have it down to 10 or 15 minutes, right? So things kind of change. But insufficient time. I remember I had a group of brand new nursing students. They were in their first term. This was a long time ago. Um, it took her 3 hours to give a bed bath. the first time. She had never given a bed bath before. She wasn't a CNA. She was right out of high school going into nursing. She had, like I said, had never given a bed bath. So it took her 3 hours to give that first bed bath. The first head to toe assessment at lunchtime, I had to go pull her out of the room because I was like, look, you've been in here for 4 hours now. Everybody's hungry. We're gonna go take a break. We're gonna regroup. We're gonna look at what the data you've collected, and we're gonna pick it back up after lunch. But when I tell you, she took your med surge book and how each chapter, like each section of assessment for each body system, she had all those questions written down on paper and was literally going through each system question by question. I was like, okay, let's work on this a little bit and see how we can, cut this down a little bit for you to be a little more manageable time wise. And she did great. By the end of the term, she was good. She got it down to a science and it was fine. But so it's different for everybody. But time is always going to be a big thing. Cultural differences, right? And cultural differences could be communication, right? It could be that it's a male client that doesn't want a female nurse, right? There's lots of different cultural considerations that we can take into consideration when we're looking at that. If you don't know how to collect the data, that could be a problem as well, right? If you haven't developed a synchronized way for data collection, right, that's going to be a barrier. And personal bias. We know how, bias and um, prejudice can affect how we care for our clients. Make sure you check those at the door. Identify that you have that bias, and then still go and treat every single client with the same respect. Um, and that's another, that could also be a huge barrier. So we have to make sure that we are looking at ourselves when we're getting ready to do this assessment. So I do have to give you guys another break. Let's do a shorter one. Let's be back at 4:45 and we will finish up this chapter. All right, we're gonna finish up chapter 12. Give everybody a second to get logged back in. All right, so goals and outcomes. So goals and outcomes are established, right, during the planning process. Um, and so some of the things that we need to keep in mind about goals, they are a statement of what needs to be done or what is going to be accomplished, okay? Um, and in order for us to do that, we use SMART goals, generally speaking, but for one, they need to be realistic. Okay. They need to be attainable based on the client's condition, the client's desire to attain the goals, right? So, for example, if we want to write a goal that says the client is going to, I know, quit drinking, okay? But the client has no desire to quit drinking, are we ever going to meet that goal? No, right? So they have to be attainable. They also have to be desirable by the client. They need to be measurable. Okay, so that tells you how you will know that the outcome has been reached. Um, so for example, if we have a patient that has had a hip replacement, and so we're going to say let's say one of our goals is the patient will walk 25 feet, by post-op day 2, okay? We know that 25 feet is our measurable goal. And if they don't walk that 25 feet by post-op day 2, then, right, then they haven't met that goal. And time referenced. So like I said, post-op day 2, that would be my time reference. So it's just a guess, as to how long it will take that person to attain the outcome. All right. So again, goals done during the planning process. All right. They need to be realistic. They need to be measurable. They need to be time referenced. And so I will go to the next slide. So here we go. So here is an example of a nursing diagnosis, a nursing problem, and the outcome. All right. So the nursing diagnosis is altered nutrition, eating less than the body needs. The nursing problem, the client is only eating 5% of each meal related to loss of appetite and weakness. The outcome, the client will eat 1,500 calories of ground foods and drink 2,000 mLs of liquids during each 24-hour period by day 10. All right. So it is realistic, it is measurable, and it is time oriented, right? So interventions. So here are the interventions. We're going to offer 6 small meals, or 6 small ground meals at 8 a.m., 10 a.m., noon, 2, 4, and 6 p.m. We're going to put the client in an easy chair with minimal assistance, encourage them to feed themselves, and then assist only as needed. All right, so that's one intervention. That's to get them to eat that 1,500 calories of food. The next intervention is to offer 240 mLs of liquids at 6 a.m., at 9, at 11, at 1, at 3, 5, 7, and 9, and vary their choices. Okay. So here it tells you what the client likes. He likes or they like Jello, they like ice cream, they like 7 Up, they like chocolate milk and pineapple juice, and likes his herbal teas with meals. All right. So we have the outcome is to eat the calories, drink the fluids. All right. And so we have two interventions, one at foods, one at fluids. Oops. So data collection for our outcome evaluation. All right, we're going to check the intake. So we want to know the amount and type of fluids that they're drinking in milliliters, and we want to know how much food that they are eating per at each meal. All right. So the client will eat, again, the outcome was the client will eat 1,500 calories of chopped foods and drink 2,000 mLs during each 24-hour period by day 10, right? Was that what it was? Day 10? Day 10. Yes, by day 10. All right. Our evaluation by day 10, the client was able to consume 1,500 calories in ground meals and 1,600 mLs of liquids during a 24-hour period. So, did they meet that liquid goal? If the goal was 2,000 and they're only drinking
No.
1,600, no, they did not meet that liquid goal, right? So we need to go back, right, and look at some potential interventions in order to help them meet their liquid goal. All right. Other, oops, I'm so sorry. I like played with my mouse and it just decided that it was going to change a whole all the slides. So nursing interventions, and outcomes classifications. So NANDA International or NANDA I, all right, those are the system, it's a systemized taxonomy that we are used to determine our client concerns. So everybody has seen a NANDA I diagnosis. You may have even written a NANDA eye diagnosis, right? So there is a book of NANDA eye diagnoses, that, and you can even, in your, I want to say, oh, I know your med-surg text has a variety of nursing diagnoses listed in your book as well. But that is where we get our nursing diagnoses is through that NANDA eye. The NIC, or the NIC, is our nursing interventions classification. It's a way of identifying standardized nursing interventions. So, what does that mean? So, yes, there is a standardized list of nursing interventions that are available depending on whatever the diagnosis is. So that is available. And then, of course, we would look for those nursing interventions that are more specific to our patients so that we're not just picking some random nursing, interventions. And then we have the NOC, which is the Nursing Outcomes Classifications. It is a system for measuring client outcomes as a result of those nursing interventions. Um, excuse me. Um, and so we look at that. It just standardizes the terminology and the criteria for those outcomes. And it's a Likert scale. I don't know if anybody has heard of a Likert scale before, but you guys have done surveys before. So you get a survey, sometimes we get them in our emails, you get school surveys, and it'll tell you like, it'll give you five, like on a 5-point scale, like how likely are you to recommend this business, right? Not, never, rarely, maybe, um, most of the time or all the time, like whatever the scale is, it's usually like a 1 through 5. And so the NOC, it's a Likert scale. So never demonstrated, rarely demonstrated, sometimes, often, and consistently. And so we literally can give them a score to identify if they've met their outcomes. And remember, when we look at that nursing process, the RN is going to have the final decision on the nursing diagnoses, the choice of the nursing interventions, as well as measuring those outcomes. Now, we still, as LPNs, you're going to give your input and, help to identify some of those interventions that we are using. All right, but that final say is going to be on that RN. And then the last little part of this is going to be about care plans. All right. So we talked a little bit about care plans, not a whole lot, but we talked a little bit about care plans, and I told you about my mom's 16-page care plans that she used to have to write. Um, Care plans vary, okay? Depending on the type of electronic medical record system that you use. So, you're putting in your documentation as to um, what do you call it? Their medical diagnoses. You're putting all of their assessment information in there. And a lot of times some of the electronic medical records will actually kind of show like a standardized care plan just from the information that you've entered into it. It's based on research, so standardized care plans, they are out there, and it's going to give you, it's what's the word I'm looking for? It's going to generate the best possible outcomes for whatever nursing diagnosis is there. All right. Um, so if you put that same nursing diagnoses that, your patient is eating less than body requirements or whatever the nursing diagnosis was, it's going to give you a list of, potential options that you could use for that nursing diagnoses. Individual care plans, okay, those are care plans that are tailored specifically to your client. So that's going to meet the specific needs and goals of your individual client. So let's say you have a new admission, all right, and you are gathering your data and you put everything into the computer system, and based off of, medications and medical diagnoses, and whatever other key words that it picks up, it is going to generate a standardized care plan for you. All right. Now we can take that standardized care plan and then we can customize it and make it individualized. All right. So we can go through and we can look at all the interventions and we can pick interventions that are specific to our client. And that is an individualized care plan. All right. So again, a lot of places have those standardized care plans, but then you can take that and you can modify it and you can individualize it for your clients. Because not every intervention that is going to pop up on that standardized care plan is going to be appropriate to your client, right? So, for example, if he's not eating enough for his body requirements, what if he's a tube feeder? And I know it's a little bit different, but um, maybe it's a tube feeder who isn't getting enough formula. All right. And so we have to adjust that. Obviously, he's not going to be able to eat chopped foods, right? We can still increase his fluid intake if we need to increase his fluid intake, right? So that's what I mean. So you can take a standardized care plan and then individualize it to your client. These multidisciplinary care plans, and these are a lot that more common things that you're going to see, especially in a long-term care, rehab, things like that. It is where everybody kind of has an input and a part in that care plan. And I'm going to stop sharing for this. So we may have, you know, they may be, getting physical therapy, occupational therapy, speech therapy, and all of those departments are all going to have goals for that patient in their care plan. There may be nutritional goals that for that client. There may be respiratory goals. I'm trying to think of what else. Who else we got? Um, PTOT speech. Um, it respiratory, dietary, right? It could even be activities. And so anybody that's worked in a long-term care, we know that we have some clients that just want to stay in their room all the time. They don't want to socialize. They don't want to come out, right? But they may have some goals, right, to increase their socialization, right, to attend activities. So those multidisciplinary care plans are effective. And it's a way that everybody can kind of see what's going on across each department, right? Are they meeting their goals for physical therapy and occupational therapy and speech therapy, whatever, so it's a really, and it's like I said, it's a good way for, communication across each discipline to occur. And so just, keeping that in the back of your mind. Like I said, standardized care plans have a place. And you can generate that standardized care plan and then just take that and individualize it to your client. And that will, help you to um, make it, specific. So. All right. So that it was, I know it wasn't a very long chapter. So that was chapter 12, all about the nursing process. So we did chapter 4, which was a little history on practical nursing. We did chapter 12, which was the nursing process. Does anybody have any questions on well, we talked about chapter 4. Does anybody have any questions about the nursing process?
No, but
No.
will we get those PowerPoints?
I'm sorry?
I said no, but will we get those PowerPoints that you had?
They're in the announcements.
And then okay, I looked at the ones on the module. Okay.
Okay. So yes. So if you go to your announcements, excuse me, I want to say I'm just looking real quick just to make sure. It is the welcome to week 1 announcement. You'll have both of the slide decks there. So it's under that welcome to week 1 announcement. And then your professional development, I did put an announcement. I'm not sure if anybody looked at it yet. But there is an announcement about your professional development paper as well. There's a YouTube video for you, and there's also a sample professional development plan that is there. So if you open it up, it will give you a lot of information. And what I will tell you honestly, when you look at this, um, when you look at the sample, um, it outlines your APA. So this is something to also pay really close attention to. It outlines the APA, and I'm going to share my screen and show you. So I just opened it in the shell. So you see page number right hand corner. This is what your cover page should look like. You put your section number there, put the date underneath it, and then you will write, this is the title of your paper. You can even use these headings. So this paper is set up exactly in APA format. So if you download it and just take out the like this part where they wrote in, then you can literally even use those headers for your paper. And then so it shows you the correct way to use your headers as well. All right. And then when you get down to the end, so conclusion is done, you can do your conclusion here. And then you have your references. This is the correct APA formatting for your references. The first line is normal, the second line is indented, or actually, the second and subsequent lines are indented. So. This is, like I said, this is an APA formatted paper. So if you downloaded this to use as a template, you would literally just, or you can, adjust, of course, you can adjust your headers and things. But you can take this verbiage out, and then just put your own information in. But it really gives you a lot of really good information there about how to write your papers. So your, like that template is available to you. Um, so, um, any other questions?
Is it possible for us to do the paper early, submit it to you, and you review it before it's due?
Mhm.
Okay.
Yeah, you can send it to me and I will review it and give you feedback. Even if it's before, um, the due date, if you email it to me, I can review it, email it back so you can submit it. However you want to do it is fine. But yeah, absolutely. I will tell you probably the biggest areas that people generally lose points on is going to be APA formatting. So really read through that and look at how to APA and or how to do the APA format. Also, too, not referencing information. So you will have to put this through the plagiarism checker. All right. So you want to be below, I always say 20%. Okay. As long as APA, as long as it says, as long as it's green, you're good. If it is not green, that means that you need to go back and review your paper. And I know that everybody can see what the results of their turn it in is before you submit it in, once you to do that final submission. So make sure
I
when
have a
you,
question about that.
uh-huh.
What if we do like when we do our whole original paper, but let's say we use the same sources as somebody who like submitted the paper before, like if we use like generic sources. Because that happened to me before. I turned in a paper, but it says I used the same sources. So it said my turn it in score was like a 50.
Okay. So in those situations, just let me know. Okay. If you've looked at it ahead of time, because
Okay.
yes. So I will still, even if you turn it in, if you submit it with a high turn it in score, I'm gonna look at the turn it in and make the determination,
Okay.
right? Because a lot of common phrases, your references, even sometimes the title of your paper, your header names, all of that, right? They
Like the class
sometimes
name,
will,
it was like the class name, the school, the basic textbook. It all
yeah.
made my score go up.
Yeah, that stuff I don't pay attention to it. I look at the other stuff like the meat of the paper, making sure that um it isn't word for word. That I mean, unless you've used a quotation, um and even if you've used a quotation, if it's properly cited, it won't be a big deal when you look at it from Turnitin. But just want to be really careful with making sure that you know how to do your citations and that you're giving credit where credit is due, so that you avoid all of that. If there's an issue, just let me know and I can look at it beforehand and kind of tell you what is kind of, if there's something that, we could potentially make some changes in. So. All right, all those are all good questions. Any other questions? Nope. All right. So, other things that you are going to see throughout this term, you're going to see some math questions pop up. All right. Never done with dosage calculations. So you will see some dosage questions come up. Excuse me. I will also be putting some practice questions in the announcements for you. These are going to be practice questions. Once we look at prioritization and delegation, I'm going to put some practice questions in there for you to kind of get you to think, through those questions. Um, for some reason, I don't know what, there we go. Um, they're going to be there. I will post the questions and then a couple of days later, I will post the answers. The same thing with the math questions. Dr. Tenza will go in, she'll post the math questions, and then in a couple of days later, then you'll get the answers. My suggestion is that you try to do the questions. That's always going to be your best, the best bet, just to see if you could, answer the question if it's something that maybe you need to review a little bit more. We just kind of want to make sure that you kind of, understand the process. And if not, then, it's something that, you need to review, or it's something that you want additional tutoring on, then you can always, reach out and, ask. I was trying to pull up some questions for us to do. They don't want that many questions. Why will it not give me? It won't give me an option. Let's see. Um, I really don't want that many questions, but apparently it's going to give me 707 questions. All right. So let's do some practice questions. So we have, what do we have? We have 12, 14 minutes. I chose a little bit of a variety this time. I chose pharmacology. What else did I choose? Choose pharmacology and I chose, I don't remember. So we'll go through some questions. There's a total of 700 questions, 707 questions, and we're not going to go through all 707 questions. However, I really need to make this a little bit smaller so that it fits on my screen. There we go. All right. So in the chat, you can answer in the chat. You can answer out loud. However you want to do it is perfectly fine. And so this first question is going to be about nursing documentation. So I will share my screen so you can see the question. I will also read the question. And then we'll go through them as we answer them. So this one, I picked this one actually, I didn't pick this one intentionally. It just actually popped up. But which identifies accurate nursing documentation notations? Okay. So going, how do we write those nursing notes? What do we incorporate in those nursing notes? So this is a select all that applies. So which would be accurate nursing documentation? So we have the client slept through the night. We have abdominal wound dressing is dry and intact without drainage. The client seemed angry when awakened for vital sign measurement. The client appears to become anxious when it's time for respiratory treatments. And the last one, we have the client's left lower medial leg wound is 3 centimeters in length without redness, drainage, or edema. So of those answers, which is accurate nursing documentation?
I say 3, 4, and 5.
Okay, we got a 3, 4, and 5.
Maybe 2. I don't know.
I say 2 and
And what's
5.
5?
2 and 5.
2, 4, and 5.
2, 4, and 5, 2 and 5, 3, 4, 5. So
I'll
we
say
know
1,
for
2, 5.
sure 2 and 5. Everybody has pretty much, well, the ones that have answered, um,
2, 4, and
It wouldn't
5.
be 1. I've seen 1 in nurses' notes.
1, 2, 4, 2, 4. All right, I'll just do that. That'll cover everybody. All right, so our answer was incorrect. So the correct answers were the client slept through the night. Um, then we had abdominal wound dressing is dry and intact without drainage. Then the client's left lower medial leg wound is 3 centimeters. We know that was pretty good. So
So it was 1, 2, and 5.
it was 1, 2, and 5.
Okay,
So
so do I
Russia.
get extra credit?
Very good for answering it correctly, Denasia. You did good. So
I guess
factual
you don't want to
document.
say they appear to become anxious because, like, they didn't say that they're anxious, right?
Very
Yeah,
You don't want
good,
to
that's
right?
guess.
subjective.
Yep. Because I can appear to be very anxious, be absolutely fine, right? What is it's subjective, right? So that is your subjective view, right? If I appear anxious, right? So very good. So we want it descriptive, we want it objective, what we see, hear, feel, or smell. Okay. And just like when you just said, the use of inferences without supporting factual data isn't acceptable, right? So, how could you, in this sentence here, the client appears to become anxious when it's time for respiratory treatment? How could we make that more factual?
By putting the objective signs that you see of anxiety,
Okay, we can put objective signs. What
Like their heart
about
rate, their respirations increase,
okay, but then we
they
really
become
wouldn't want to
withdrawn.
put anxious, right? We could just be more objective and put vital signs, right? Or, right, we could, if the patient tells us they're anxious, right, we could put that the patient reports feeling anxious prior to respiratory treatments, right? So we can change that. Same thing with the client seemed angry when awakened for vital sign measurement, right? So what, you know, we could say, when woken up for vital sign measurement, client yelled at the nurse, right? Or, something along those lines, make it more objective. But good job. Let's see. All right, let's do this one. So the LPN enters a client's room and finds the client lying on the bathroom floor. The LPN calls the RN, who checks the client thoroughly and then assists the client back into bed. The LPN completes an incident report, and the nursing supervisor and primary healthcare provider are notified of the incident. What is the next nursing action? All right, so we found the client on the floor. The LPN calls the RN. The RN checks them out, puts them back in bed. The LPN completes the incident report. The supervisor and primary healthcare provider are notified. What do we do after that?
4.
Are we going to place the incident report in the client's chart, make a copy, document a complete entry concerning the incident, or document in the client that an incident report has been completed?
I'm
3.
gonna guess 4.
2 maybe?
It's
Three.
one. It's one because she
One.
already completed the incident report.
Yeah, we already did the LPN did the incident report. Everybody's been notified. What do we do next?
Maybe one.
It's a rough one,
Either
huh?
one or three.
Three.
One
There's
or three.
one or three. I'm gonna hit three for y'all, okay? And we're gonna submit. Three is the correct answer. Okay.
Okay. Good.
So this is a legal question. All right. So incident reports. We know everybody does incident reports when an incident happens, right? Absolutely. Okay. Biggest thing about incident reports is those are internal documents. Okay. So an incident report is going to highlight what happened. Okay. Why was the client lying on the bathroom floor? Were there towels on the floor? Was the floor wet? Or did he not have proper footwear on? Or maybe he just fell. I mean, because people do just fall sometimes. All right. But it's it's very detailed what as to what happened, or as detailed as we can be as to what happened. But incident reports are internal documents, okay? Those are things that quality assurance, your quality teams are going to use those incident reports. They're going to analyze the data and they're going to try to prevent that incident from happening again, okay? We never, ever, never document in a client's chart that an incident report was completed. Yes, we do the incident report. We don't document that we did an incident report. Again, that's an internal document. If a surveyor like state or joint commission or DNV or a lawyer, okay, wants access to that chart and they see that that incident report was completed, what are they going to ask for? They're going to ask to see the incident report, right? Maybe we don't want them to see the incident report. Again, it's an internal document. We don't document it. We do it, but that is not something that we're going to document in the patient's chart, okay? So never put an incident report in a patient's chart. That is an internal document. All right. Um, we're going to skip that one. Let's see. We haven't talked about that yet. Um, let's see. Let's do this one. So the nurse enters a client's room and notes that the client's lawyer is present and the client is preparing a living will. The living will requires the client's signature be witnessed, and the client asks the nurse to witness the signature. What is the appropriate nursing action? This is a good another legal question. Do we decline to sign the will? Do we sign the will as a witness to the signature only? Do we call the hospital lawyer before signing? Or do we sign the will clearly identifying credentials and employment agency?
One.
So we have one that says decline and we have three that says sign with stipulations.
One.
Decline.
I don't know, so I'm not gonna say.
Decline. Very good. Yes. Rationale for that living wills are required to be in writing and signed by the client. The client's signature either must be witnessed by specified individuals or notarized. Many states prohibit any employee from being a witness, including the nurse in a facility where the client is receiving care. So good job. That was awesome. All right, let's see. We probably have time for another. Um, Oops. Okay, so we can do this one now. We can do this one. All right, so the nurse finds the client lying on the floor. The nurse calls the registered nurse who checks the client and then calls the nursing supervisor and primary healthcare provider to inform them of the occurrence. The nurse completes the incident form for which purpose? Now, why did we fill out that incident report? So it provides clients with necessary stabilizing treatment. It's a method of promoting quality care and risk management. It's used to determine the effectiveness of the interventions in relation to outcomes or the appropriate method of reporting to local, state, and federal agencies. So what do we use that incident report for? What did I say we used it for?
Number 4.
Or
Say it
Number
again.
3.
But I said QAPI, which is quality
2.
assurance. Yep. So we are going to use it for 2. Okay. So again, that incident report, it's, we're going to look at it. We're going to review it. What the heck happened? All right. And then we're going to go back. Um, and we have these things that are called QAPIs. They're risk management. So we take all the risk, it's usually quarterly. So we'll take all the risk incident reports or all the incidents that have occurred. It's not always just nursing. Okay. It always seems like it's nursing. We'll take all the incidents that have occurred and we'll go through them and we'll look at, what happened, how it happened, why it happened. And then we'll look for ways to try to prevent it from happening again. All right, that is our time for the week. Any last minute questions?
Have a good weekend.
You too. I will see y'all next week. Have a great week.